Okay, hi, we have,
Susan Skellinger.
hi Sue. Sue is going to just give us a few minutes of her time to talk about her experience in her office, what she started with, the care that she had before starting care in our office, the results she got, and then she'll just add some of her own thoughts at the end. So Sue, if you would tell us what problem brought you to our office? How did you end up coming up to our office?
I had a strained knee for years that it seemed to be getting better, but it began waking me up at night. I was unable to sleep through a night, and it was excruciating pain.
So how long was that going on before you called our office?
About a year. And I just thought part of it was aging and part of it was a little weight gain. And then I saw an article in the Grand Traverse Women's Magazine.
Mm-hmm.
It was a ad that Dr. Johnson had placed. And it called out to me, and I knew I needed to get her. So I called her on the phone, and the next day I had an appointment. We did an evaluation. Met the second time and discussed options, and she told me what she found through the evaluation. We set up a program, and I came.
Okay, and so when you started, tell me about what concerns did you have? Were there things that some people might consider to be an obstacle or something that had to be considered before they started care?
Yeah, I do not have insurance, so this was not covered under any insurance. The expense was a partial concern. The commitment of coming in, which is about a 35-mile trip for me, one way, driving in twice a week, and I'm just uncertain about the results because I had been to other chiropractors, I had been to DOs, I had been to masseuses. I was looking for a fix, and I was willing to invest in the time and the money.
Mm-hmm. And so if you would you share what treatment did you receive? How was it different than what you've had before?
Dr. Johnson, like I said, gave me full body evaluation, neurological test. We used cold laser treatment.
Mm-hmm.
We used the
Peripheral neuropathy therapy?
yes.
Mm-hmm.
And each week was also a complete alignment body adjustment to compensate and correct the things that I had been compensating.
Now, have you ever had your knee adjusted before?
I had, but not in the manner you did it.
Okay, so that was something different. Okay.
That was new, the way that you had performed.
And so we haven't actually seen you for maybe 5 weeks
Correct.
since your last visit, and your knee's been doing well?
My knee has been doing fine.
Okay.
My knee's been
So
doing fine. There was also supplements you gave me to try. The EFAC, and it had a topical ointment. In the past, I have used Biofreeze, Arnica, Tiger Balm, numerous things like that. And this is the most amazing topical ointment, and it works. So that combined with the pills and the treatments.
Great.
Were,
So you had a pretty good resolution of the original problem.
completely.
Yeah, good. So is there anything, as we close here, is there anything that you wanted to add before we end our time together?
Well, I would like to encourage other people to come because I think Dr. Johnson has a incredible grasp of what the body needs and takes in a healing process. She's good at finding areas where there is pain where you may not realize that you have a pain, trigger points, etc. And I am pleased and grateful that I have found you.
Well, great. Thank you, Sue. Appreciate your time. Thanks.